Very much. Pleasure to be here this afternoon with all of you. This is the first time I've ever done anything like this, but I'm sure we're all trying new things with the state of the world. Just before we get started, I'll apologize in advance if you hear my dog barking or my children burst into the room. Both are potential scenarios that could happen today. So I banished them all to the yard, but I can't guarantee that they'll stay there. So what I'll be doing today is I'll be going over just a kind of a high-level overview of Social Security, kind of what kind of benefits we offer, how you can go about getting them. We'll touch on the windfall elimination provision and the government pension offset, and then I'll turn it over to Kathleen, who will be going over some Medicare-related stuff. So why don't we get right into the first slide? Awesome. All right, so Social Security came into existence in and around 1935, signed into law by FDR, and at that time, its primary responsibility was to provide low-income aged individuals with just enough money to live above the federal poverty level. It was never meant to replace in entirety someone's pre-retirement earnings. What we often say is, no one's going to get rich off of Social Security, but it is a good foundation for a healthy retirement portfolio. What I've read is that on average, you're going to need, or Social Security is going to replace about 40% of your pre-retirement earnings. And what we found is to live comfortably into pre-retirement, you're going to need to replace about 70% of that. So on average, we're only giving you about 40, which means you'll need things like pensions, savings, investments, and other forms of income to kind of bridge that gap so that you can continue to live comfortably. Let's advance to the next slide, please. So how do you qualify for benefits? Now on my screen, it's a little condensed, but you do that by earning credits when you work and pay into Social Security. You do that through taxes, through FICA and SECA. You need a total of 40 credits, which works out to roughly 10 years worth of work, and you must be at minimum 62 years of age. So for this calendar year, if you contribute $1,410 in taxes through your earnings, you'll get 1 credit. If you contribute up to $5,640, you'll get your 4 credits for the year. And you can only earn 4 credits in a year, hence the 10-year kind of minimum to get the benefit. We can advance to the next slide, please. So year of birth. Now, from 1935 until about 1982, full retirement age was one number, and that was 65 years of age. Now, full retirement age is an important concept because it's the age in which you're going to get 100% of what it is we owe you. So remember that full retirement age equals when you get 100% of what it is we owe you. So from 35 until 82, that number was 65. Now in 1983, Congress passed the Social Security Amendments Act. Now this was the last major reform that has been made to Social Security, and it was sweeping in what it did, and it changed a whole lot of our policies and procedures. One of the most important things it did was it changed full retirement age. So if you were born if you were born before 1937, your full retirement age remained 65. If you were born in 1938, your full retirement age became 65 and 2 months, 39, 65, and 4 months, and so on and so forth, up until individuals born after 1960, your full retirement age is going to be 67. Now remember, full retirement age is when you get 100% of what it is Social Security owes you. And why don't we go on to the next slide, please? All right, so here we have an individual whose full retirement age is going to be 66. And you can see 66 smack dab in the middle of that little chart there. And at 66, that person is going to get $1,000. But the chart goes 2 different ways. It goes a little to the left, then a little to the right. Now remember, the earliest you can retire is 62. That's considered early retirement. And if you retire early, what's important to note is your benefit is reduced. So for this person here, full retirement age is going to be 66. They get $1,000. If they opt to retire at 62, which they can do, their benefit is reduced by about 25%, which means they get a benefit of $750. That benefit will remain the same for forever. So if you go out at 62 and your benefit is $750, on your 100th birthday, your benefit is $750. Now, there are a few caveats to that. If you continue to work, we're constantly reevaluating your benefit. Okay, and you can see some increases based on the work. There are some pitfalls to that as well, and we'll touch on those shortly. There are also cost of living increases. So we did have a cost of living increase this year. It was 1.6%. So that would get tacked on to the benefit as well. But those adjustments don't tend to really ever, they're not usually significant bumps in the benefit. They help, certainly, but they're not huge. And as you can see, as you wait, for every year you wait, as you get closer to your full retirement age, the benefit goes up. And it keeps going up. So for every 12 months you wait beyond your full retirement age, so for this individual, 67, 68, 69, and 70, you get on average an 8% bump for waiting. Now that stops at 70. So this is what we call the retirement window. Now you can retire at any point beyond 62. Let's say you're 80 and you want to retire. That's fine, you can do that. Now mind you, the benefit is going to be roughly what it was when you were 70, and there's really no advantage to waiting till 80. But we don't mandate when you're gonna retire. We just kind of tell you what the benefit rates will be. And we can move on to the next slide, please. So like I said, there are some pitfalls to continuing to work while collecting a benefit. So remember, you can get a benefit as early as 62. Any time between 62 and the date of your full retirement age is considered early retirement. So what that means is if you're in your early retirement phase and you're still working, there are earnings restrictions that we can apply. So for this year, and the numbers change year to year. So, if 2 years from now you find yourself in this boat, you would want to reach out to us and find out what the limits are. But for this year, for an individual under full retirement age, if they earn over $18,240, we're going to reduce their benefit $1 for every $2 they exceed that figure. So what that means in the real world is this. Let's say in 2020, you earn $10,000 greater than the limit here. What would happen in 2021 is you would owe us $5,000 back, half of what you went over. Again, let's say your benefit is $1,000. What that means is your February, March, April, May, and June checks come right back to the federal government. You would not receive them, okay, because you have to pay back the $5,000 you owe. Come July, you get your first regularly scheduled monthly check. I'm sure you're asking yourself, you said it would start in February, but the year starts in January. One key thing to note with retirement checks, they occur or they're paid the month after the month they're due. So if you enroll this month and we're in April and you say, listen, I'd love for my retirement check to start here in April, we would say, great, not a problem. You won't see that check until May. The check that you receive in May is for April. So just keep that in mind. There's always a delay in the checks. So let's say you're in the year in which you're going to attain your full retirement age. Well, then the numbers go way, 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 way up. If you're in the year in which you're going to hit your full retirement age, at least for this year's standard, the increase is, or the earnings limit is $48,600. Now, if you exceed that, we're going to reduce your benefit $1 for every $3 you go over. So it's a little bit of a lighter charge to the benefit. Now, let's say you're at full retirement age or you're older than full retirement age. At that point, you can earn whatever you want. There's no longer any earnings restriction for work and benefits. So you could go get a job, you can earn whatever you want there. We're not going to take away from your check. Caveat again, there's always an exception to every rule, taxes. You do have to pay taxes on both your earnings and your Social Security. And you can thank again the 1983 Social Security Amendments Act for the taxation of your benefits. But there is no penalty other than that. And we can move on to the next slide, please. So if you're here today because hopefully you're thinking about retirement, you're planning for retirement, you're just curious about retirement, one of the places I would point you to is our website, socialsecurity.gov or ssa.gov. Once it learns how to speak, it'll put me out of a job because pretty much it has all of this information. In my opinion, it delivers it much better than I do. And it's an extremely useful resource. Probably the most important one we have is the retirement estimator. If you want to know what your benefit is, this is where you go. It can tell you anywhere from that 62 to 70 window what your benefit's going to be. So if you want to know what your benefit is at 62, you can get it there. 65 in 6 months, it'll tell you that. 70, it'll tell you that. 69 in 3 months, it'll tell you that too. One of the other things that's on our website that's very useful is setting up a My Social Security account. And this kind of lets you control the process once you've done it. You can use that account to apply for benefits, print out a 1099. If you're getting benefits, you can use it to change your address, your phone number, your direct deposit information, get a benefit statement. Especially in this world now with all of the scams and fraud that is going on, you establishing an account prevents a fraudster from doing it. So it's valuable in that. If you're younger than 60, you probably haven't seen a benefit statement in about a decade because we stopped issuing them. But about 10 years ago, every American, every person in the country who worked got a benefit statement. And this was just like a 3 or 4 page document that said, you've contributed X into Social Security. If you have enough quarters, you're eligible at 62 for this amount, at your full retirement age for this amount, and at your delayed retirement of maximum benefit of 70, this amount. If you had children, it listed what they were eligible for. If you have a spouse, it listed what they were eligible for. And most importantly, it listed a breakdown of what we have on record for you as having contributed into the system. You could see what we have on record, what we're using to make our calculation of your benefit. And you do want to check that periodically to make sure that it is correct, because what you don't want to have happen is you come into our office to file for benefits and find out we're missing 3 or 4 years worth of your work for whatever reason. And the benefit statement allowed you to keep an eye on that. If you sign up for one of these accounts, that is something that you can check. It's right there on the page, and you can double check your earnings to make sure we have all of the right information. So again, the site's socialsecurity.gov, and it's a huge resource for anyone who's kind of looking into their own retirement coming down the road. And why don't we move on to the next slide, please? All right, so let's discuss the kinds of benefits we offer. We offer spousal benefits. Now, how spousal benefits will work is the spouse is eligible for 50% of the primary wage earner's benefits. Now, this does not impact your benefits. So let's say myself and my wife are eligible for retirement. Her benefit is $2,000. At my full retirement age, I'm eligible for half of hers, so $1,000. If I am younger than my full retirement age, my starting point is half of hers, and then it's reduced for how young I am. So if I'm 62, I'm looking at about a 35% reduction. So if her benefit's $1,000, it's $650 or something like that, that would be how the reductions work. So if you take a benefit early, whether it's your own spousal benefit, widow's benefit, whatever it may be, they are going to be reduced by how young you are in that cycle. So spousal benefits came into existence in and around 1937 or so. And at that time, most households were single income households, which meant the math worked very simply. You take the primary wage earner's benefit, half it, and that's what the other individual would get. Nowadays, we don't run into that. We run into a lot of dual income households. So when you have that, this is how a benefit would work. Again, I'll take the example of myself and my wife. If my wife is eligible for $2,000 and I am eligible for $800, I am eligible for $200 from my wife's record. Brings me up to half of her value. So basically, if you're eligible for your own benefit, they're going to subtract that from whatever it is they take the difference between yours and your spousal benefit, and they pay you that difference. So I'd get $800 from my benefit and $200 for my spouse's benefit. Brings me up to half. Now let's say my benefit is $1,200. Half of my wife's benefit is $1,000. So my benefit exceeds half of my wife's. In that instance, I don't get anything. Your own benefit has to be less than half of your spousal benefit. And if it is, you get the difference between the two. I'm going to throw out a date, January 1st of 1954. I'm going to throw out 2 dates. January 1st of 1954 is the first. The second is essentially 2015. In 2015, Congress changed some rules regarding Social Security, part of the Bipartisan Budget Act. And what they changed was, prior to 2015, if I had walked into my local Social Security office and said, hey, listen, I'd like to apply for half of Mrs. Reno's benefit today. I'm 66. I want to get $1,000 from Mrs. Reno. Agent would have sat me down and said, sure, not a problem, Mr. Reno. Now, Mr. Reno, I also see here you're eligible for your own benefit. Now, do you want to take that benefit today? And I said, you know what? No. I'm going to leave my own benefit be, and I'll come back in at 70, and I'll get it then. I'll get my delayed retirement credits. I'll maximize that benefit. I just want half of Mrs. Reno's. We would have shook hands, and that would have been that. I'd get half of my wife's benefit. After 2015, same scenario. I walk in. I say I'd like to apply for half of Mrs. Reno's benefit. They'd start taking the application and say, oh, Mr. Reno, notice here that you're eligible for your own benefit. Would you like to take that today? And say, no, I'd like to leave it, and I'll apply for it at 70. And say, well, Mr. Reno, were you born before January 1st of 1954? And clearly I wasn't. I would say no. And so, well, because of a rule called deemed filing, if you're eligible for your own benefit, you have to apply for it before you can access your spousal benefit. Now, as long as your own benefit is less than half of your spousal benefit, we'll be able to take an application for both today. However, if your own benefit exceeds your spousal benefit, you can't apply for it. You're not eligible. And that was a rule that changed back in 2015. It's called deemed filing. Now, if you were born before January 1st of 1954, erase everything I just said from your memory, because you're grandfathered into the old rules and you can apply, you can mix and match, pick as you wish which benefit you'd like to get. Now, there is one exception to that, and we will touch on that in a moment. Why don't we advance to the next screen, please? So, divorce spousal benefits. The math works exactly the same. Divorced spouse is eligible for 50%, of the primary wage earners benefits. You have to be unmarried. You have to be a minimum of 62. Your ex-spouse has to be entitled to Social Security. And you have to have been married for a minimum of 10 years. We've had individuals, I had an individual call who had been married for 9 years, 11 months, and like 20 days. Unfortunately, not eligible. It's a 10-year minimum. There's no wiggle room around that. All right. You cannot have remarried. So if I'm attempting to apply for my spousal benefit from Mrs. Reno, we've divorced, I've remarried, I'm not going to be eligible. All right. And there are some exceptions to that rule, but by and large, you're just not eligible. We can go to the next screen, please. So I've touched upon this a couple times, but again, I just want to reinforce the point. If you take a benefit early, whether it's your own, you're taking a spousal benefit, whatever it may be, the earlier you take it, the greater the reduction is going to be. So if your full retirement age is 66, your own benefit, if you were to take it at 62, would be reduced by 25%. Your spousal benefit would be reduced by 30%. And you see this chart here goes all the way down to about a 5% difference between your own and a spousal. For those of us born after 1960, your own benefit at 62 would be reduced by about 30%, and your spousal benefit would be reduced by about 35%. So really the most important thing to take away from this is if you're going to go out at 62, 3, 4, 5, anywhere in that kind of ballpark, you're looking at a slightly lowered benefit. And we can move on to the next slide, please. Survivor's benefits. Okay, so survivor's benefits work very similar to spousal benefits, except now instead of dealing with 50% of the benefit, you're dealing with 100% of the benefit. So if I were to predecease Mrs. Reno, upon my passing, she's eligible for 100% of what it was I was getting. Now, if she is getting her own benefit, they're going to do the same kind of math that they did while I was alive. They're going to look at her benefit and look at mine and figure out the difference between the two. Let's say Mrs. Reno's benefit is $1,800 and mine was $2,000. Upon my passing, she would continue to get $1,800 from her own benefit, and she would get $200, bringing her up to my $2,000 from my record. If her benefit exceeded all of my benefit, upon my passing, she doesn't get a benefit. For survivor's benefits, you can actually collect them as early as 60. Again, if you do that, they're reduced about 30 to 35% depending on when you were born. Alrighty. If you are disabled, you can collect them in your 50s. You'd be filing for a disability claim. If you go that route, if you find yourself to be disabled, there is no reduction. Okay, you get 100% of whatever that benefit is. Disability works a little bit different than just regular retirement benefits. Okay. Survivor's benefits are the only instance for someone born after January 1st of 1954 where deemed filing doesn't apply. So again, if I were to pass away, at 60, my wife could come in and apply for 100% of my benefit. And she does not need to apply for hers She's not mandated to apply for hers at any point in her retirement window. So if at 62, she doesn't want to apply for mine, she doesn't have to. She could let her own, pardon me, I misspoke. She doesn't want to apply for her own, she doesn't have to. And she could let hers continue to build value up until whatever point she decides that she wants it. And then she could apply for it. This is the only, like I said, the only instance for individuals born after 54 that you can still kind of pick and choose between your own benefit and a spousal benefit going forward. And we can go to the next slide, please. All right, so lastly, we offer benefits for children. For us, a child is anyone under the age of 18, okay? If that 18-year-old is receiving a benefit and they're still in high school, they can continue to get that benefit until they turn 19 or graduate, whichever comes first, okay? For them to be eligible, one parent must be getting either disability or retirement, all right? And the other thing to keep in mind is if your child has a disability that we can prove prior to the age of 22, they can potentially continue to get this benefit for forever. They'd be considered a disabled adult child. If they don't have a disability, as I said, the benefit would stop at theoretically 18, 19 at the latest. And we can move on to the next slide, please. So how do we figure out your benefit? I'm sure you've all wondered how we figure out your Social Security benefit. Well, we're going to take your earnings. We index them. We make sure they're up to standards for cost of living. And we add up your highest 35 years. We then divide those by 420, which is the number of months in 35 years, and this produces your averaged index monthly earning amount. Basically, a number that we say over the course of your working life is the average that you earn month to month. Next slide, please. And this is where it gets really fun. We then apply the bend points, okay? And what these are is a dissection of that averaged indexed monthly earnings amount. So let's say you have an individual whose average index monthly earning amount is about $6,000. They'd get a Social Security check of $2,400, $2,440. Now remember, when I started off, I said nobody gets rich on Social Security. If theoretically Elon Musk could apply for Social Security today, and he was at his full retirement age, the most he would get is $3,000. That's it. He has contributed far more than that. That there's a cap on how much you can receive, both be taxed on and receive. So how did we get to 2440? Well, we take that 6,000 and we dissect it by these bend points. So we take the first $960 and we multiply that times 90%. We take the next $961 through $5,785 of the 6,000. We multiply that times 32%. We take whatever's left and we multiply that times 15%. Add that up, and that's your benefit. Clear as mud, I'm sure. You'll never meet someone in the field who will sit down with pen and paper and do this anymore. All of the computers do it. But this is this is how we would figure out your benefit. Let's move to the next screen, please. So 1983, again, remember the Social Security Amendment Act, last major sweeping reform to Social Security. And one of the things that it did, which we do encounter here in the state of Massachusetts, is it invented the windfall elimination provision, very popular provision. What the windfall really, who it impacts are traditionally, especially here in Massachusetts, are teachers, firefighters, policemen, people who pay into what we consider at Social Security a non-covered pension. Basically, they're not paying into Social Security. They may be paying into Medicare, but they're not paying into Social Security. There's no Social Security FICA tax coming out of their earnings. If we can go to the next slide, please. When you're looking at the windfall, it impacts your ability to get your own benefit. And there's some real confusion between two different things. There's the windfall elimination provision and the government pension offset. They both come out of the 83 amendments, but they work very differently. If you find yourself being impacted by the windfall, you will get a Social Security benefit. You are entitled to something. The windfall cannot, let me repeat, the windfall cannot reduce your benefit to nothing. Now, what can happen is it can reduce it below the Medicare premium. And in that instance, what will end up happening is you still get the money, but our good friends over at Medicare take it and apply it to your premium. So you pay a lower Medicare premium. You don't get a Social Security check. There's no Social Security money coming directly to you. It's being intercepted by Medicare, but it is being applied to the premium. So you do get something. So all the windfall does is it changes the first bend point. It changes the first set of math that we do to figure out your benefit. And instead of multiplying your first 960 times 90, we multiply it times 40. That's it. The maximum that we can windfall someone is $480. If doing that would reduce your check to nothing, we have it. So let's say your benefit was $100 and you are going to fall into that windfall category. Well, you'd get a Social Security check at 50 bucks. That's it. That's all there is to it. Another point I always like to make a stress here is windfall only applies when you're getting your Social Security benefit, and there's a little small box here, Social Security benefit and your pension at the same time. If you're only getting Social Security and you are not yet collecting your state pension, we will not windfall you. However, the first month that you're getting them concurrently, you need to let us know, because then we will offset your benefit. Let's move on to the next slide, please. All right, there's one exception to windfall. For individuals who have worked and paid both into Social Security and into their state pension, if you have a certain number of years, and you should have received a handout for this, a certain number of years paying into the system, the amount of windfall can become smaller. So if you have what we call 20 or fewer years of substantial earnings, you get the full windfall. If you have 21 years of substantial earnings, well, now we're taking your first 960 and multiplying it times 45%. 22, 50. Go all the way up to 30. If you're one of those individuals who has 30 or more years of substantial earnings, you're windfall exempt. You get a full Social Security check and you get a full pension. Your homework assignment, and I'm sure some of you have some free time at home, is to go online, pull up your My Social Security account, and go to your earnings record. The green handout that I hope was included with this, that has the windfall kind of description, on the back side of that is a listing of what the substantial earnings were for each year. You just want to go through and check your earnings against those years. And if you find that you have greater than 20 checks on your assignment, that means the amount of windfall that you're going to encounter is less. And depending on how many are here, that'll determine how much less. There's also a cheat to this, and we can advance to the next slide just for time. There's a cheat to this. We have a windfall calculator. So you can just let that do its magic rather than sitting there with pen, paper, and checking through your years. But whichever method you decide you'd like to use, you can. We can move to the next slide, please. Last thing. So government pension offset. Government pension offset is the twin sister of windfall elimination provision. They're not fraternal, though, because they don't look exactly alike. What government pension offset impacts is your ability to get a benefit from your spouse. So my father's a teacher here in Massachusetts. My mother isn't. If my father would try to take half of my mother's benefit at the same time he's getting his state pension, what we would ask him is, we'll need to see the gross monthly amount of your state pension. Next slide, please. We're going to take 2/3 of that state pension, and we're going to subtract it from whatever it is you're eligible for from your spouse, from your spouse's Social Security benefit. So if my father was eligible for $1,000 in Social Security from my mom, and his 2/3 of his pension was $800, he'd get his full pension and a spousal Social Security benefit of $200. $1,000 minus the $800, $200 is what he gets from us. Now, if 2/3 of my father's pension is greater than my mother's Social Security benefit, my father gets nothing from Social Security. And that's the government pension offset. Again, another one of those concepts that's kind of as clear as mud. Let's go to the next slide, please. I think that might be it for me. We'll go, just understand, depending on how much you earn, your benefits can be taxed. And what I'll finish on is how you get in touch with us. Now, we are still open now during COVID-19. We're not open to walk into an office, but all of our offices have phones. They're fully staffed right now. So you can call us at our local offices. You can call us at our 800 number, 800-772-1213, or you can visit us online at, again, socialsecurity.gov. And as I said, we're working at full capacity. We're just not open to walk-in traffic at this time. And with that, I think we'll probably do questions at the end. I'll turn it over to Kathleen for her portion. Thank you very much.
Okay, thank you, Kevin. That was great information, and it dovetails well, I think, with what I'm going to talk about. Good afternoon, everyone. I appreciate the opportunity to participate in this presentation. My name is Kathleen Grant, and I am the Assistant State Director for the State Health Insurance Program, which is otherwise known in Massachusetts as SHINE. My goal today is to just introduce you to the basic concepts when planning for Medicare. This is by no means comprehensive, but we will try to give you some guidance on what your next steps would be at the end of the discussion. So we can go ahead and go to the next slide. So the acronym SHINE stands for Serving the Health Insurance Needs of Everyone. And the caveat there is it's everyone with Medicare. And the reason for that is we have over 600 certified counselors in the state that are trained very specifically to deal with the Medicare beneficiary population. So that's our focus, and that's where our expertise lies. Most of these, or to say many of these counselors are actually professionals, but the bulk of our counselor base are highly trained volunteers. Our mission in SHINE is to always provide free and unbiased insurance counseling. And we do it not only directly to the beneficiaries, but their families and caregivers. We're able to work with them if we're not able to work directly with the beneficiaries. Counselors usually in outside of the COVID-19 timeframe do counseling one-on-one at senior centers. And as Kevin mentioned, there's some challenges now with the way we're trying to do outreach to folks, but we are trying to get in touch with folks by phone, and folks can still call their local senior centers, and most of those calls get channeled to us eventually. You can go to the next slide. Okay, so a few important things before we get started. You need to remember that Medicare is not free. There are premiums and there are gaps for several parts of Medicare. It's a very complex subject, and no matter what your education level or your background level or what you did for a living, it can still be very, very hard to understand. Also, this is important. Everyone's situation is different. You know, you'll hear from friends and relatives that the plan that they have is the absolute best and you should look into it. And the truth is it may be the best plan for them, but not necessarily for you. Also, some of the rules related to Medicare vary widely by state. So what you're going to learn about Massachusetts today and what you'll learn when you speak with a SHINE counselor in Massachusetts is not necessarily something that you're going to want to share with your friends in Florida or California, because the rules are very different, again, from state to state. You can go to the next slide. Okay, so why is it important to plan for Medicare? Well, as I'll explain, if you enroll at the wrong time, it can mean that your access to coverage could be delayed, and you might even be assessed penalties for missing certain deadlines. Medicare rules are extremely complex, and unfortunately, sometimes you might find out what you need to know after the fact, after something has happened. Also, and I think this is important to note, healthcare expenses are becoming a much larger portion of total spending in retirement. Kaiser did a study the Kaiser Foundation did a study in 2018, which indicated that about 41% of an individual's Social Security income was going towards out-of-pocket health expenses in 2013, and they expected that percentage to rise by 2030 up to 50%. So 50% of that payment that Kevin was talking about earlier is projected to go towards health expenses within the next 10 years. Okay, we can go to the next slide. Okay, so Medicare is a federally funded health insurance program. But again, it covers only some of the costs of healthcare services for its beneficiaries. Coverage is also available just for services that are deemed medically reasonable and necessary for the treatment or diagnosis of illness or injury. And that's something that your physician is going to make the determination on. But you need to understand that there are some services that are not covered by Medicare. And there are rules in place where if you go in to get those services, your doctor is required to alert you that Medicare may not be covering them. But just be aware that Medicare does not cover everything, and it does not cover every service. We can go to the next slide. Okay, so there are 4 parts to Medicare. People get somewhat confused by this alphabet soup, and it takes a while to get used to this. But in general, you've got 4 parts of Medicare. You have Part A, which is your hospital insurance that essentially covers your inpatient stay at a hospital. You have Part B, which is your medical insurance. That covers your doctor's services both in and out of the hospital, any other outpatient services you receive, lab tests, blood work, things of that nature. Then you have Part C, which is also known as Medicare Advantage. Medicare Advantage is an alternative to original Medicare, which essentially bundles your hospital, medical, and prescription drug coverage all under one plan. And we'll talk a little bit more about that later in the presentation. And then finally, you have Part D, which is a latecomer to the Medicare family, but it was established in 2006. And Part D is the standalone prescription drug plan that's available to individuals that are on original Medicare. And we'll do a slightly deeper dive into each of these. Next slide. Okay, so we talk about who is actually eligible to have Medicare. So Medicare is open to individuals 65 or older who are US citizens or legal residents for at least 5 continuous years. It's also available to individuals who may be under 65, but who have received 24 months of Social Security disability payments. There are also exceptions to that 24-month waiting period for individuals with specific illnesses like end-stage renal disease and also ALS. Next slide, please. Okay, so Medicare has different enrollment periods that you should be aware of. The initial enrollment period is the 7-month period that starts 3 months before the month of a person's 65th birthday, and it ends on the last day of the 3rd month after your birthday month. So let's, as an example, say if you were born on July 4th, your initial enrollment period would start on April 1st, going 3 months back to the 1st of that month, and it would be over on October 31st, 3 months after your birthday month, the last day of that month. For anyone who's already receiving Social Security benefits when they turn 65, so as Kevin showed on that slide, people that start receiving it at age 62, they're actually automatically going to be enrolled in Medicare A and B when they reach the age of 65. They aren't automatically enrolled in Part D in drug coverage. That's their responsibility. That's something they need to do separately. And we'll talk a little bit more about that later too. But for anyone else who's turning 65 and they want to enroll in Medicare, the burden is on them to take action and apply through Social Security, either in person or online. Okay, we can go to the next slide. Okay, so during the initial enrollment period, when you choose to enroll can have a significant impact on the actual start date of your Medicare coverage. So as you can see from this chart, if you need your Medicare coverage to start on your birthday month, you actually need to go in and enroll during any of the 3 months prior to your birthday month. If you delay for any reason, even if you delay until your birthday month, your effective date begins to move out further. So if you waited until the last month of your initial enrollment period, like as in our previous example, if you waited, you would then have to wait until the end of October, essentially November 1st, to get your coverage. So if you wait until the last month of your initial enrollment period, your Medicare coverage would not start until 3 months after that month. Okay, we can go to the next slide. So the answer to the question, when should I enroll in Medicare, is very different for each individual. If you and or your spouse are working past the date when you become eligible, which is usually at age 65, when to sign up and for what parts of Medicare is dependent on several factors. When an employer has less than 20 employees, they usually require Medicare eligible employees to enroll in Medicare, which then becomes their primary coverage. If you're covered, however, in a high deductible plan with a healthcare spending account or an HSA account, you need to suspend those HSA contributions 6 months in advance of signing up for Part A. And we're seeing more and more companies that are offering high deductible plans with healthcare spending accounts. So it's important for you to check with your HR department regarding signing up for Medicare when you turn 65 if you're in that situation. Okay, we can go to the next slide. So in some cases, it may be appropriate to delay your enrollment in Medicare. For Part A, most people do enroll at age 65 because it is premium free, unless, as we previously noted, they're still contributing to an HSA account. If you're currently covered by an employer group health plan, either your own or a spouse's plan, you can delay enrollment in Part B without penalty. You can also delay enrollment in a Part D plan as long as your current prescription drug coverage is considered creditable. And that's something that your employer can confirm for you, whether your prescription drug coverage is considered creditable. And that's a term that essentially is defined as being as good as Medicare Part D coverage. Okay, we can go to the next slide. Okay. If you have delayed enrollment past age 65 because you had employer coverage, you have what's called a special enrollment period after you stop working, or if you lose that health insurance for some reason, you have this period to apply for Medicare. It's a special enrollment period that lasts up to 8 months after the date you lose the employer coverage. And in order to avoid any late enrollment penalties, you'd need to pick up your Medicare coverage before that 8-month period ends. Now, most people are going to try to time this to pick up the Medicare coverage. There would be little reason for them to wait the 8 months, but the 8 months is important to remember in case something else happens and people tend to forget or they think that they can go without coverage. But the 8-month period is the period of time you have in order to avoid any kind of penalty before signing up for Part B. If you miss the opportunity within that 8 months, the window closes for you. And the next time you would be able to apply for Part B would be during the general enrollment period, which is at the beginning of the year from January 1st to March 31st, and which actually delays your coverage until July 1st. So if you are someone whose initial enrollment period or your special enrollment period ends towards the fall, you're going to have to wait until the beginning of the following year. And then more than that, you're going to have to wait till the middle of the year to actually get coverage. So you can leave some significant gaps out there where you're not covered. And that's why we really stress, again, to be aware of what these deadlines are and when these special enrollment periods are available to you. Okay, and just to mention the penalty, which we footnoted here, if you do happen to miss that enrollment window for signing up for Part B on a timely basis, once you are able to sign up, you will have a penalty tacked on to your Part B premium, which represents 10% of whatever the current Part B premium is. Those Part B premiums go up every year, so your penalty will move up with it, and that penalty does stay with you for life. This is why we really emphasize people being aware of timing when it comes to signing up for Medicare. Okay, we can go to the next slide. Okay. There's also a special enrollment period for Part D or prescription drug coverage, but of course the rules are different than the rules for Part B, because that's Medicare, and because Part D was added later to the Medicare family, they for some reason didn't have the rules be cohesive with what was already in place, and they created a whole new set of rules. So if you delay your enrollment in Part D coverage past the age of 65, because you have coverage from an employer plan, you actually have 2 months from the end of that coverage to pick up a Medicare prescription drug plan. This presumes, again, that the drug coverage that you had through your employer plan was considered creditable. And again, that's something your employer can verify for you. If you miss this special enrollment period, you may have to wait until the Medicare open enrollment period, which happens every fall from October 15th to December 7th, to pick up Part D coverage. And like Part B, late enrollees do face a penalty. In the case of Part D, the penalty is actually 1% of a national base premium for every month that enrollment is delayed past the month that you were eligible to pick it up. Okay, a lot to absorb, I know. Okay, so now let's talk about COBRA coverage a little, because this is where we see a lot of folks slip up and misunderstand what their obligation is in terms of signing up for Medicare. So when leaving employment, whether voluntarily or involuntarily, you may be offered continued health coverage through COBRA. It's extremely important to understand how COBRA works with Medicare. Most importantly, COBRA does not qualify as current employer coverage, and therefore it does not protect you from the Part B late enrollment penalty. However, since the prescription drug coverage offered through COBRA is usually considered creditable, COBRA does protect you from the Part D late enrollment penalty. So COBRA can be taken to supplement Medicare, but it's typically quite expensive, and there are other options for you to consider in supplementing Medicare, which we'll talk a bit about. So be careful and understand that if you're offered COBRA, if it is not current employer coverage, if you're not currently on your employer rolls as a participant in their regular insurance plan, your time period has started, the clock has started, and if you don't get in by the windows either for the initial enrollment period or a special enrollment period if you've lost employment, that window is going to close for you, and you taking COBRA is not going to protect you. Okay, we can go to the next slide. Okay, so earlier we introduced parts A and B. We noted that part A covers hospital insurance and is premium free for most individuals who've earned the necessary 40 credits or 10 years of working that Kevin mentioned earlier. But we also need to point out that there are what are known as gaps in part A coverage, expenses that you, the beneficiary, will ultimately be responsible for. This includes a hospital deductible as well as co-pays and co-insurance. There are also some limits on coverage in skilled nursing facilities that you need to be aware of. With Part B, which is your medical insurance, covering all your doctor's services and outpatient services, you'll be paying a monthly premium for that, and it's based on your income, and there'll still be gaps in coverage due to co-pays and an annual deductible, which will also be the beneficiary's responsibility. Okay, we can go to the next slide. So as a result of the Affordable Care Act of 2010, there are a number of preventive services that are covered by Medicare Part B and are provided at no cost. What you see here is just a partial list of the health screenings that are included, including mammograms, colorectal screenings, and some diabetes self-management training. Part B also covers, you'll see at the bottom there, what's called an annual wellness visit. It's important to note that an annual wellness visit is not an annual physical, but rather a discussion between you and your doctor regarding your health and management of any ongoing health issues. A complete list of the preventive services covered by Part B, it's actually a 2-pager, I believe it will be available and distributed to you after this session. Okay, we can go to the next slide. So this is what we tried to conceive of as a roadmap about your Medicare coverage choices. So Medicare beneficiaries can choose to get their coverage in one of 2 ways. The first option, which is shown here on the left of the chart, is to enroll in Part A and Part B, again called Original Medicare, and add a separate Part D prescription drug plan, and potentially add a supplement or a Medigap plan to cover the aforementioned gaps in coverage. Adding a supplement is completely up to the beneficiary. It's not required. There's no penalties for not doing it. There's obviously a cost involved in picking up a supplement, and we'll talk about that in a bit. But again, that's a completely voluntary piece, and it has nothing to do with Medicare. These plans, Medigap plans, are sold by private insurance companies, and Medicare has no jurisdiction over them. So now, alternately, the beneficiary on your right side of the screen may choose to enroll in a Medicare Advantage plan, also known as Medicare Part C. With those Medicare Advantage plans, your Parts A, B, and D coverage are all bundled under one plan, and you would not be able to purchase a supplement plan, nor would you need one when you have a Medicare Advantage plan. Okay, we can go to the next slide, talk a bit more about supplement plans. So Massachusetts currently has 7 insurance companies that are offering supplements or Medigap plans. There are currently 3 levels of coverage available, and this is new in 2020. There's what's called the core level, Supplement 1A, which is a new level, and Supplement 1. Now, enrollment in Supplement 1, it's important to note, is closed to anyone who's just becoming Medicare eligible. However, anyone who was Medicare eligible as of January 1st, 2020 would still be allowed to apply for this program. So if you were past age 65, which is when you were Medicare eligible, and you're now 67, you would still be able to apply for Supplement 1 because you met that 1/1/20 cutoff date. But for anyone else, you know, newer waves of retirees coming in, Supplement 1 is not going to be open to them, and I'll explain why in a moment. So each of these products offers varying levels of coverage for deductibles and coinsurance. The premium you pay depends on the level that you choose. There are no referrals required, in any medical practice that accepts Medicare will accept any of these plans. Note that the supplements don't include drug coverage, so the beneficiary would still need to have a separate Part D prescription drug plan. And also, and this is unique to Massachusetts, or not necessarily unique to Massachusetts, but it's something that is unique about the Massachusetts enrollment process, is we have what's called continuous open enrollment, which means that beneficiaries have the opportunity to enroll or disenroll or change between plans at any of these supplements from month to month. There's no such thing as an open enrollment period here for Medigap plans, which is different than supplement offerings in other states where there may be many more choices and limitations on when you can enroll. So essentially, the main reason that Supplement 1 was was closed to new applicants or new enrollees is Supplement 1 was a level which covered all of your copays as well as your hospital deductible and your Part B deductible. And there was a congressional act passed a couple of years ago in which the decision was made that they did not want any supplement plans to be continuing to offer coverage of the Part B deductible to any new enrollees. They wanted beneficiaries to take responsibility for that amount themselves, and it's currently $198. So the first $198, it's a deductible, and Part B would be the responsibility of the beneficiaries. And for anybody new to Medicare, they need to absorb that. The rules have changed, and now they no longer can buy a plan that would cover that for them. Okay, I think we can go on to the next slide. Okay. So now we turn to Medicare Advantage plans or Medicare Part C. Advantage plans are usually organized as either HMOs, health maintenance organizations, or preferred provider organizations, PPOs. The important thing here to understand is that these are private plans that offer services through a network. And a specific network of doctors and facilities means that the beneficiary has perhaps fewer choices, or definitely fewer choices than if they were going to a Medicare provider. They need to work within the network in terms of a primary care physician and in terms of specialists and they do need to get referrals from their primary care physician. So the premiums for Medicare Advantage plans are lower or can be lower than some of the supplement plans, but Advantage plans may also have, even after you've paid the premium, as you use services through Advantage plans, you will have co-pays and co-insurance that may be due. As we noted before, prescription drug coverage is almost always included. And if you do select to go the Medicare Advantage route, you would have to make sure you have to take the drug coverage that comes with whatever Medicare Advantage plan you select. You would have to make sure that your prescriptions are covered by their formulary. And probably most importantly, before you select a Medicare Advantage plan, you would want to make sure that your physicians, the physician or specialist that you want to deal with, accept a particular Medicare Advantage plan. That's always something we stress to people before they make any decisions about moving in this direction. Okay, we can go to the next slide. So there's no answer to the question, which route is best? And we get asked that a lot at Shine. And again, like everything else with Medicare, it's a very individualized decision. It's really based on your health, your financial situation, your flexibility in changing providers, you know, where you are in your life. Are you doing a lot of traveling? Do you stay within your home base or do you go overseas? I mean, we ask a lot of questions like that to try to help people come to the right choice. But we did create here a very high level list of a few of the pros and cons of each approach. And I mentioned a few of these in talking about it. On the left, you have your Medigap Supplement 1 coverage as an example. You're going to pay a higher monthly premium, but you're paying money up front, and after that you're not seeing a lot of co-pays or co-insurance. You have the freedom to choose doctors. You can travel across the country. Any doctor that accepts Medicare is going to take your insurance, and you don't have to do any, get any referrals ahead of time. You're covered anywhere in the United States, and if you have a Medigap, you will also be able to get foreign travel covered. But also in terms of caveats, you'll notice it says there that there are a lot of additional services like hearing and vision that are not part of Medicare. Medicare doesn't cover things like that, original Medicare. You'll get some minor add-ons with some of the supplements, but they're not particularly robust offerings. So that's the Medigap with original Medicare side of the fence. On the other side, we have Medicare Advantage plans. Again, lower premiums, but it's more of a pay-as-you-go instead of pay up front because you will have co-pays. You are restricted to a network, so you need to be mindful of that. You may need referrals. A lot of people are used to that with current types of insurance plans that they have through employers. There is the benefit of getting some extra benefits. Their vision and their hearing offerings can be more robust. And unlike original Medicare, which doesn't cover annual physicals, they just cover that annual wellness visit I mentioned. There is an annual physical that comes with Medicare Advantage plans. But remember, they are only covering you within their service area. So not just the network of doctors, but the network of facilities. They will only cover you for emergencies. Okay, next slide. Okay, so now I just want to spend a few of our remaining minutes talking about Medicare prescription drug coverage, or Part D. Although Medicare, interestingly, considers Part D optional, They do assess a penalty if you're a late enrollee. If you decide you're not going to take it when you're first eligible for it and then try to pick it up later on, you can during certain periods, but you will be assessed a penalty. And once again, that penalty will stay with you. Anyone who has either Part A or Part B can enroll in a Part D plan. And beneficiaries, again, can obtain that prescription drug coverage either through a standalone Part D plan or through a Medicare Advantage plan. So we can go on to the next slide. Okay, so there are 4 coverage phases as part of the Part D standard benefit. Some drug plans have a deductible, others do not. And that is the situation where the beneficiary is going to pay the full retail cost of the drug before they start to get the benefit of lower copays. So when their out-of-pocket spending has reached that deductible limit, and in 2020, plans have been allowed to have a deductible no higher than $435. But once a beneficiary has either reached that limit or if they are in a plan that has no deductible, they go into what we call the initial coverage period. And that is where the beneficiary, the consumer, will pay approximately 25% of the retail cost and the plan will pay the balance. I think it's important to note, though, that retail cost is a very variable number, and not all plans have the same retail cost for all medications on their formulary. And we'll get into how you can, the tool that you can use to sort of research that and make sure that maybe you're staying with the best plan. If someone pays out a total of $4,020, and this is a combination in total retail cost of what the plan has paid and what the consumer has paid, they then enter what's called the coverage gap, or has been affectionately known as the donut hole. And when this first started, the donut hole percentage of what a beneficiary had to pay was a lot larger. It has been shrinking or closing over the last few years, and it is now down to 25%, which is what the beneficiary, the consumer, would owe once they reach the donut hole. And then the catastrophic period, which sadly we do see a lot of people go into if they are on a lot of very expensive drugs, they may go into that catastrophic period very early in the year. And that amount is $6,350 for this year. Then the percentage that the consumer has to pay drops significantly to about maybe 5% of the retail cost. However, the retail cost for drugs, for some of those drugs that put them in that catastrophic category, can be extremely high. Okay, we can go on to the next slide. So we always warn folks that come to Shine that when you're choosing a prescription drug coverage plan, you have to be aware that plans may differ greatly in terms of the retail cost of the drug, whether or not the drug is on their formulary, the tier that they have the drug on, any restrictions on quantities or requirements for prior authorization or step therapies and things like that. Also, many plans have preferred pricing relationships with certain pharmacies, and the choice of where to have your prescriptions filled can make a significant difference in your total cost. So if we want to go to the next slide. So this is something relatively new that Medicare started promoting last year, and there really is a lot of benefits to folks that are new to Medicare. One of the first things we suggest they do is they go on to Medicare.gov and they establish what's called a MyMedicare.gov account. There's a lot of tutorials on the web about how to do this. Shine has one out there themselves, but essentially you are setting up a password protected way for you to get into your own Medicare account, and to then be able to use what's called the Medicare Plan Finder tool on a much more personalized basis, because the Plan Finder tool, which does exactly as it says, it helps you to select the correct drug plan for you from year to year, can actually, through the My Medicare account, access your personalized Medicare information, find your prescription drug history, pull that list in, allow you to amend it or update it for any changes you've had during the year, and really help you do a much more thorough search as to what the best drug plan is for you. The other benefit of MyMedicare.gov is that you will also have access to all of your Medicare claims, benefit statements that come in. If you want to go paperless, you can do that, but either way, you'll have online access to those as well. So we encourage that. At Shine, if you are uncomfortable doing that, Shine can help you set up that account and get you going on it. So, okay, I think we're good with that. All right. So we encourage beneficiaries to come and see us, not just when you're initially enrolling in Medicare and in a drug plan, but we ask people to put it on their calendar to come back and see us every fall during Medicare open enrollment, which runs from October 15th to December 7th for coverage the following January. And the principal reason is that, you know, it's not a case where you just pick a Part D plan when you're first on Medicare and then you don't have to worry about it from year to year. I'm happy with it. It's serving me well. I can tell you a lot of stories we had of people that leave it, don't change it, and then go in on January 1st and find that the current plan that they had is no longer covering a drug, or the drug has changed to a different tier, and all of a sudden their copays are a lot higher. And there is no going back and saying, well, I didn't know that, and now I'd like to change the plan, because again, these windows of opportunity are very firm in Medicare. So it makes sense for you to either come into Shine and have us check, or you can actually go on the Plan Finder and do this yourself. But again, we always stress it's important to compare plans every year. Okay, I have a couple more slides and I think we'll be done. So Medicare costs change every single year, and I think you'll be getting a copy of this presentation, so these amounts might be helpful. But we have a lot of folks that are trying to cost out and budget and say, I'm ready to go on Medicare, how much is it going to cost me? So these are the things you need to think about. So Part A, again, is going to be premium free for most folks who have earned those 40 credits. You've been paying into it all along. However, you want to remember that you do have that hospital deductible of $1,408 anytime you go into the hospital. And it's important also to note that if this is not necessarily an annual deductible, if you go into the hospital at the beginning of the year, you'll have to owe that deductible. If you're out for more than 60 days and you're hospitalized again, you have what's called a new benefit period that started, and you may owe that deductible again. This is again with just original Medicare and no supplement to help you out. Part B premium is currently $144.60 a month per person. This is for your medical insurance. You need to be aware that there are higher premium levels for folks that earn a certain amount, over a certain amount. I believe right now it's for a single person, if you earn over $85,000 a year, you're going to be paying a higher premium. And for couples, it's $170,000, twice that amount. And those income adjustment amounts also tend to change from year to year, but that'll just give you some idea in terms of budgeting. And as you can see here, I mean, for extremely high income individuals, that premium can actually go up as high as $491.60. And that annual deductible of $198, that's when you go into the doctor's office or you have blood work or lab work done at the beginning of the year. The first $198, if you're on original Medicare, is going to come out of your pocket. And then from then on in, Medicare will be paying 80%, and either you or your supplement will be picking up the 20%. And if you have a supplement, again, it doesn't matter, because with the new rules, you're always going to owe that $198 unless you're grandfathered into Supplement 1. Medicare Advantage premiums, you can see the range is really broad. They go from 0 premiums, but again, the lower the premium, the higher the copays you're going to pay if you start using the services. And then we have higher premium Medicare Advantage plans for $266. And again, it's an inverse relationship, higher premium, lower copays. Part D drug plans, this year, the least expensive one is $13.30 a month. They go all the way up to $128 a month. Vast amount of differences for, you know, again, depending on what kind of drugs they're covering and what their retail costs are. Like Part B, if you are at a higher income level, you may have to pay more for this Part D plan as well. They do charge a premium to the folks that are making more than that $85,000 and couples more than $170,000 a year. And finally, Medigap plans, the premiums, the least expensive core plan is $104.10. The most expensive Supplement 1A plan is $282, and the most expensive Supplement 1A plan, I'm sorry, 1A plan is $282, and the most expensive Supplement 1 plan is $270. So again, these are numbers that just we provide to help you do a little bit of number crunching to realize that coming off of an employer plan, sometimes some people pay less when they're on Medicare, but a lot of times people end up paying more when they're on Medicare for their health insurance. Okay, and I think the last slide we have, a couple more slides. We just wanted to very quickly let you know that in addition to Medicare counseling, when you come in to see us, we do screening for public benefits programs. These are programs that are designed to help pay for the costs of Medicare. We do screening for both federal and state programs. They're based on income and assets. And I mean, some are for very low income individuals, but some, you'd be surprised, are for moderate income individuals, and they can really help assist with paying premiums and mitigating some prescription drug costs. So and they've expanded the eligibility for some of the state programs this year. So we really encourage people when they come in to see Shine to ask to be screened for those programs. And we're more than happy to help determine if you're eligible and also help you with any applications that need to be done. Okay, I think we're okay here. And this is our last slide. You're going to get some brochures, I believe, that have these numbers on it. But for Medicare assistance, first place you're going to go when you sign up for Medicare is you're going to go visit Kevin and his folks, and that's where you sign up for Medicare. And again, you can do that either online or in person. Right now, as he mentioned, they don't have offices open, but their phone lines are open for assistance, and they do have a terrific site where you can actually do a lot of things online. And then once you've got that Medicare card in the mail and you want to figure out what path you want to take to Medicare and you want to figure out what drug plan is best for you, that's when we want you to call us at Shine. Right now, as I said, we're not doing one-on-one appointments, but if you give us a call, we will hook you up with someone that can work with you over the phone. And hopefully when we're all back to a little bit of a state of normal, we'll be able to once again be hosting informational sessions for folks at senior centers and doing one-on-one appointments. So I thank you so much for your attention, and if there's any questions, I'm more than happy to answer them.